Welcome to Plaid for Women TV, your go-to resource for the business of life. Whether the CEO of your home or your own business, women struggle with the same challenges. At Plaid TV, we discuss real-life issues affecting real women and offer solutions to help you achieve your goals, get connected, and be heard. Together, we will change the world. Let's do this. No mean girls allowed.
Hey, welcome everybody to Plaid for Women TV. I'm Siobhan Palmer. In this video, we're talking about pelvic floor health. My guest is Dr. Marie Warner. Dr. Warner is the Assistant Professor of Physical Therapy at the University of North Texas Health Science Center in Fort Worth, Texas. Dr. Warner, welcome.
Thank you.
Okay, so let's talk in this video causes of pain as it relates to the pelvic floor area. I know in your practice you get many people complaining about pain, so tell us some of the more common reasons for pain in the pelvic area.
So some patients that come with pelvic pain, they could have a variety of different diagnoses, whether they have painful bladder syndrome or IC, or endometriosis or fibroids or cysts in that region. All of those things can contribute to muscle spasm or shortening of the pelvic floor. Traumas to that area can also lead to muscle dysfunction or shortening of those muscles as well. So they all can lead to pain in that general area. Stress. That's another thing. So,
stress is huge. When you say trauma specifically, could that be somebody who's been the victim of a sexual assault, for instance?
It could be. It could be a sexual assault. It could be a very traumatic delivery. It could be a fall, any of those things.
Okay, so tell me what treatments you offer to your patients relative to focusing in on pelvic pain.
So it's a little bit different than it's a little bit different than if someone were coming in with just a muscle weakness. And so we do an evaluation to assess what the state of the muscles are. If there's a lot of pain and tenderness and the muscles are not able to completely relax, then instead of doing something like pelvic floor exercises, we would do soft tissue and relaxation techniques and things like that to encourage the muscles to completely relax.
So what actual procedure do you do to ascertain the pain level in that area? Do you do like similar to an OB-GYN type procedure?
So we do an evaluation and assess those muscles. So it is an internal exam, but it's not like an OB-GYN exam. There's no speculums involved. It is simply palpation of the muscle.
So it's not like a pap smear. It's very, very different experience.
Yeah, there's not the speculums, and it's just an insertion of a finger and then just palpation to see if they're tender, if they're painful, if they're able to completely contract and relax, things like that.
Okay. And you hear the term Kegel quite a bit for various reasons. Why don't you describe in layman's terms what a Kegel exercise entails?
So a Kegel is a pelvic floor contraction and then relaxation, and then doing that whether you hold that for a long time period or doing those quickly and able to completely relax. With this patient population, I usually, if they are not able to completely contract and relax the pelvic floor and there's a lot of pain and tenderness to palpation, I would not recommend them doing Kegels because they're not going to get an effective contraction and they're unable to completely relax.
That would even add more to the pain, I would imagine.
It could make their pain worse. It could make their symptoms worse.
Yeah.
If they have incontinence, it could make that worse. But yeah, it's one of those things. If the muscle's not functioning 100% correctly and not able to completely relax, then pelvic floor exercise is not something I would recommend them to do.
Okay, and just to complete this, I wanted to ask you, how would you ascertain whether a patient's actual pelvic floor region was contributing to the pain, that it was the cause of the pain?
That's a great question. So a lot of people that maybe they didn't have a trauma, maybe they don't have, maybe they didn't have like a traumatic delivery or never had kids or anything like that, but they're experiencing some of those symptoms, whether it be like pain with intercourse. That's typically something I'll ask, like if they have a history of pain with intercourse, unable to wear tampons, a history of painful GYN exams. Those things can kind of, I don't want to say they always predict, but if they're experiencing those things, it could be because their pelvic floor is non-relaxing or not functioning like it should be.
And typically when you recommend a course of exercises to address these issues, what time frame you're looking at? Is this something they would do for the rest of their life, or just does it vary with patient to patient?
So if they're coming for pelvic pain, a lot of times I'll see my patients for longer time periods because we're having to retrain a muscle to improve it the way it's functioning. So by being able to relax, as opposed to just strengthening. And so with strength, I mean, yes, whenever they start doing the pelvic floor exercises, like they would have, I mean, that's a life issue. Like they're going to definitely want to incorporate that for the rest of their life.
Just like they would do any other exercise regimen, right? Dr. Warner, thank you very much. Ladies and gentlemen, this is Siobhan Palmer with Plaid for Women TV. See you next time.
Thanks for watching Plaid TV. See you next time.